Thank you for joining for another session here with the legends in urology, the icons that actually molded and created a new area during the first years that we were practicing urology and the training. So here we are with Dr. Jack McAninch. Probably he was the urological trauma surgeon at UC San Francisco that everybody in the world would follow his advices, guidelines, and follow very closely his thousands of publications. So I'd like to welcome Dr. McAninch, and I'd like you to, this is more about your life and how you built all this practice, and now that you have some more time, we're very honored actually that you showed up in this meeting like a cameo. And so tell me, Dr. McAninch, how do you feel? I know that you're still going and working, but not having to deal with the administration or in the middle of the night getting calls about this renal trauma grade 5 or 4. Please tell me what life is like nowadays.
Well, I tell you, it's really wonderful not to have call, not to have to go to meetings, but still working.
Yes.
I go to work every day, work with the residents and in teaching. So all that's really fun. I love going to the teaching conferences because I always have something to say. May not always be on the mark, but you know, my contribution is always there.
Yeah.
So it's all fun.
Yes.
And so there's no reason to walk fast to get to any place. You can walk slowly. There's no rush.
That's right.
And that makes a big difference in your life. So I'm enjoying myself. And of course, I'm thrilled to be in Jackson Hole and back at this meeting, and
Yes.
remembering Ralph Hopkins and how the meeting started and all that.
I can see that you're wearing this vest that was especially given to you as mine. Mine is newer. Yours is probably from the first meetings. Can you just tell the audience a little bit about how important it is for me and you?
I do believe the first meeting I came to was 1987. And that was even before the time they were given prizes for the speakers.
Right. And
we met here in this building. Then it was called the Sojourner Hotel. And we met downstairs in a little corner, so to speak. And so it was really a different kind of meeting. But Ralph, at that time, had already come up with the idea of having the critique panel, and we had a critique panel, and it's just as it is today. So it
happened in the bar, I heard first, right?
No? It could have, because I think Ralph started, and you'll know this more better than I do, perhaps 81 or 2, and I was a speaker maybe in 87. And so it gradually evolved and changed. I think Jay Gillenwater was his very first speaker, and that was the only one that was here, was Jay.
That's right.
So, you know, then he got the speakers, then he decided the critique panel thing would work.
Right.
And then it became, with the critique panel, such an educational experience for everyone. So, you know, I never missed a meeting after that. I always came back. And of course, Ralph, I was, you know, critique panel chairman on the critique panel, all those kinds of things. And then kind of became an advisor for him. Jerry Jordan and I did.
But you are still, I mean, you're emeritus.
Well, it is wonderful because we helped Ralph to select speakers because he didn't know everyone personally that was coming, and so we helped him because Jerry and I knew the speakers that we would suggest, and so therefore we began to get these outstanding speakers, and the speakers would come back then as part of the critique panel later. And that was a great reward in a way for the speakers who worked so hard to come back and be on the critique panel. And of course they, by that time, really understood how the critique panel worked and functioned. And so it was a wonderful educational process for everybody that was here.
And Jerry Jordan, he came several years later and started to help you and Ralph.
Yeah, no, that's right. Jerry, I think Jerry, if I'm not mistaken, came the first year that Ralph decided to give these bronze prizes. And so after that, Jerry was kind of, he and I were partners in a way as part of it. And so Ralph and Jerry and I kind of decided, then we decided to expand it and get an advisory group, educational advisory group. And that group, continues today, a wonderful group of people. And always, Ralph had always had an international speaker come, and we helped him select.
He was always very particular about doing that.
Yeah, very particular about having an international speaker. So they came from Europe and England and Australia, New Zealand, Japan.
Korea,
China.
From Brazil, China. It was always.
They were all over the world. But he always had one international speaker, and that was really marvelous. And we helped him select those kind of people to come. And of course, I don't recall anyone ever saying no.
So I was always curious, and I come from a different generation, and you come even from a even more different generation. And I heard stories you were on a special banquet with tuxedos, and you'll be called, rushed to San Francisco General because you were the trauma GU surgeon. And I can't believe you were by yourself, always taking care of these patients, always giving your 110%, publishing all these papers, being president of the AUA, being president of the WAST. And we have something very in common, that is not only the vast story, but Ralph Hopkins, Jackson Hole, but Gene Moore. And Gene Moore and you classify all the renal traumas, all the GU traumas, and you lived all your life in a county hospital. I lived all my life in a county hospital. So I feel like somehow connected spiritually.
Yes.
But my question is, how did you survive and accomplish so much? I mean, doing trauma 24/7, right?
Yes.
Writing papers and traveling the world and being also the president of the International Society. Wow. Having three beautiful, wonderful, intelligent, great skiers, sons, that they always come here with you once a year. That is special. That is, not anybody can do that. And we keep trying to read about time management and all success and all that. I'd like to hear from the person who did it all. Please tell me a little bit about it.
Well, when I finished medical school at University of Texas in Galveston, I didn't have enough money to leave Galveston, and so I knew I wanted to be a surgeon, and so the chief of surgery there, Dr. Blocker, suggested I join the military. He says, you can get a good education and you'll have an opportunity to develop fine clinical skills. So I did. I joined the Army and was moved to San Francisco. And so I did my internship and residency in urology in San Francisco in the Army. And then I stayed on active duty from 1969. Well, I graduated 64, was a resident till 69, went to Germany for 3 years, practiced in Germany in the military, came back to Letterman as on the faculty until 1977 when I got out of the Army and joined the faculty of the University of California.
Uh-huh.
When I went to interview at the University of California, Bill Blaisdell was the chief of surgery.
Right, Blaisdell, yeah.
And Blaisdell was a noted trauma surgeon, and he had a noted trauma faculty of 10 trauma surgeons at San Francisco General, and that's where they wanted me to work, was there. And so I go to interview with Blaisdell, and Blaisdell was a very firm, kind of hard-nosed old surgeon, vascular surgeon.
Right.
And he said to me, what makes you think you can start to do trauma here? And I said, well, I'm interested, and I've trained in the military. I've got some experience. So he said, well, you've got to come for every trauma that's a GU trauma if you expect to be considered a GU trauma surgeon.
Okay.
And so that's how I got locked into 24/7 trauma coverage. Of course, I was the only faculty or the only urologist there. And so I said, Dr. Blaisdell, I'll come for every one of them, but if your guys do one of the GU traumas and don't call me, I'm going to be in your office right away. And he said, it's a deal. So the time went by for about, I don't know, maybe 3 or 4 weeks. And Don Trunke, who's a prominent trauma surgeon.
I know.
And Trunke did some kind of maybe closed a bladder or something, I can't remember. And I found out about it the next day. So I go into Blaisdell's office and I said, Dr. Blaisdell, Dr. Trunke did a GU trauma case last night, did not call me. And he said, don't worry, I'll take care of it. And it never happened again. They always call me, and I always went. And I didn't have a fellow or anyone covering for me, so I covered it weekends, all the weeks. I mean, there was no time when I was off. And then in 1989, I got the first fellow, so I was about 12 years or so just by myself covering trauma, and it was a great experience. I wouldn't want to do it again, but it was terrific. And the trauma surgeons quickly began to realize that I was a competent surgeon. I could do the stuff, and so they always call me. And then they began to look at me as a general surgeon who just did GU trauma. So I was part of their social atmosphere. I was part of their faculty meetings and everything. So I was just a general surgeon who did trauma. So it was a wonderful relationship. And all those guys became lead surgeons around the country, chairs of Oregon, North Carolina. Right. Frank Lewis is the executive director of the American Board of Surgery, and so all those surgeons were there. Yeah. And so it was a wonderful experience. Then the fellowship began in 1989 and continues up to today. And
that's right. And one of your ex-fellows now is the chief.
Is the chief, yeah. and I don't know, I think I trained about 25 fellows. I think 23 of them are in teaching academic institutions, so I'm very proud of that.
And I think indirectly I was trained by you because I gotta tell you. So Gene Moore, I had the similar experience. I really wanted to do trauma surgery.
Yeah.
And that was the place to go, Denver, with Gene Moore. And I just, was called after my urologic trauma to go back. Never looked for a job, it was Denver Health and that was it. That time was Denver DG, Denver General, and I loved that. So, if you had to do something different from the time you started your job there, what would be that thing that you do different in life, in profession, or anything?
No, I don't think I would do anything different that I can think of. I just feel very fortunate to have had the opportunity to do what I did.
Yeah.
When I started out into college at Texas Tech, I majored in animal husbandry. I was an animal husbandry major. I got a BS degree in animal husbandry.
Wow.
And then I went to the University of Idaho, got a master's degree in animal husbandry.
Okay.
Before I went to medical school. So, I grew up on a ranch farm out in West Texas. So, I mean, to be a prominent surgeon is, it's a gift. So, for me, I really I feel very thankful to have the experiences I've had, and I wouldn't do it any different.
So how was your relationship with Ralph Hopkins?
Ralph was a complex person, as you know. That's a good way to describe it.
That's a great way.
But he was one of these guys who just had ideas and was very intense in what he wanted to do, and yet he was one of the most gracious type characters you could ever imagine, and he was a real character, because in the meeting, a guy runs over 1 minute, he stands up, calls him down, time's over, you sit down, It didn't matter if it was the most prominent guy in the country,
Yeah, it was.
So, but Ralph was one of these guys who was always very generous. That's where I got this jacket.
Right.
I've got multiple other jackets, and I remember when I was the chair of the critique panel, they gave me a pair of boots because he said, you've had those boots for 20 years, you need a new pair of boots, and that kind of thing. So he was a very generous guy, and always full of fun. He was always interested in having a good time.
What would you say to people that never attended this meeting? Why is it important? Why do you think they should come here?
Well, there are a couple of things educational-wise that anyone who's not been here needs to know. First of all, because of the critique panel who critiques each speaker, these speakers put together their very best talks. And they really work on these talks because they know they're going to have someone in the afternoon go over seriously what they said and ask them detailed questions. So you get a wonderful educational experience, and perhaps the best of it all is the critique panel, because that's where a lot of things come out, and it's kind of fun to see the sort of nip and tuck discussion, the disagreements.
Correct.
And the audience gets to participate. And as I remember, our critique panel runs about 3 hours, so I mean it takes a good deal of time to critique the talks that go on in the morning. And besides that, good grief, you get 5 hours of skiing. And the skiing is wonderful, but this meeting is the most educational meeting that I've ever been to. I mean, it's very broad-based, because if you look at the speakers, there's a stone speaker, a cancer speaker, reconstructive speaker, all area of urology basically gets covered, and so it's really wonderful.
Nowadays we even have public health and things like that we never had before, because of the landscape of the healthcare system that is so different. But I am curious if you still like Westerns and John Wayne, because do you remember the set of DVDs that I sent you with a little portable DVD player.
Yes.
I wonder if
Oh
you
yeah, no, I
still
love watching.
the Western.
I love
movies.
watching those old films like that, and you know, it's fun to sit down even on the television and watch bull riding these days, so you can still
You
see it.
the championship. But what do you do usually nowadays after work or before work just to relax?
You know, there are 2 or 3 things I really enjoy.
Mm-hmm.
One is cooking. I really enjoy cooking. So I do a lot of grilling, and I come up, you know, I would say the 5 or 6 magazines that I take are all cooking magazines. So I take all these, so I get ideas for different kinds of recipes and stuff. And so
And the boys come and eat with you?
Well, no, my sons don't really live close enough to do that, but I would say this because my sons grew up, the 4 of us together, because I was divorced, and they came to live with me when they were 5, 7, and 9, and they lived with me until they went off to college. And so all of them are cooks. So when I go visit them at their house, they all do the cooking. So we have a good time, you know, doing that. But I enjoy cooking. And I do a lot of reading, and the reading I focus on right now is around the American Revolution. I'm very interested in the history. And so I've read, I don't know how many books that relate to the revolutionary time when the Constitution was written and the Declaration of Independence, and the characters who played parts in that.
Right.
And we think we have trouble today. You should read some of the things happened then.
Nothing new, huh?
So anyway, that's kind of what I do in my spare time. You know, and of course I enjoy going to work, and I do, you know, I do keep up with the urologic literature, and still go to the meeting, go to the AUA every year, and you know.
That is awesome. So, before we finalize, what are your last advices that you can give to the new generation of urologists coming to the field with a different healthcare system?
Well, I realize the challenges are different than it was when I started doing the business, but on the other hand, just be thankful that you're given the opportunity to take care of people, to be a physician, and to participate in life in such a way that it makes a difference for a patient, because sometimes we forget to remember to be thankful for those kind of opportunities.
Thank you so much. God bless you, and we're gonna see you every year. Right?
Right. I've enjoyed it so much, the connection. So thank you very much for having me. I appreciate it.
Thank you very much, Jeff.
Okay.
Thank you. All right.